Alcohol withdrawal is a serious condition. It can be even more challenging in patients with chronic obstructive pulmonary disease or COPD. COPD, which includes conditions like emphysema and chronic bronchitis, makes breathing difficult. Alcohol withdrawal can further complicate this. It can lead to respiratory problems. This is why managing alcohol withdrawal in COPD patients requires a specialized approach. One of the biggest concerns during alcohol withdrawal is the potential for respiratory failure. This occurs when the lungs can't effectively exchange oxygen and carbon dioxide. This can be life-threatening. Therefore, close monitoring and prompt medical intervention are essential. The goal is to safely and effectively manage withdrawal symptoms. At the same time, we need to support the patient's respiratory function. This often involves a combination of medications, oxygen therapy, and close monitoring. Early intervention is key to preventing complications. This is a complex medical situation. It's important to rely on the expertise of healthcare professionals. They can provide the best possible care for these vulnerable patients. Oxygen therapy is crucial for many COPD patients. It helps them breathe easier. Two common methods of oxygen delivery are nasal cannula and high-flow oxygen. A nasal cannula is a common sight. High-flow oxygen therapy delivers oxygen at a much higher rate. The choice depends on the severity of the patient's condition. Oxygen therapy is vital for managing COPD patients. Respiratory failure is a serious medical condition. It occurs when the lungs can't provide enough oxygen or remove enough carbon dioxide. There are two main types, type 1 and type 2. Type 1 is low oxygen levels in the blood. Type 2 is high carbon dioxide levels. Both types require prompt medical attention. Section 4. Librium for alcohol withdrawal, benefits and risks in COPD patients. Librium, also known by its generic name chlordiazepoxide, is a medication commonly used to manage alcohol withdrawal symptoms. It belongs to a class of drugs called benzodiazepines. Librium works by calming the brain and reducing anxiety, which are common during withdrawal. For some patients, Librium can be effective in easing the discomfort of withdrawal. However, it's not without risks. This is especially true for individuals with COPD. One of the main concerns is that Librium can suppress respiratory drive. This means it can slow down breathing. In patients with already compromised lung function due to COPD, even a slight suppression of breathing can be dangerous. It could lead to respiratory failure. Therefore, the use of Librium in COPD patients requires careful consideration and close monitoring. While Librium has its place in managing alcohol withdrawal, it's essential to weigh the benefits against the potential risks. Alternative medications might be more appropriate for some patients, especially those with COPD. Section 5. Ativan, a safer alternative for managing alcohol withdrawal in COPD. Ativan, also known by its generic name lorazepam, is another benzodiazepine used in alcohol withdrawal management. Like Librium, it calms the brain and reduces anxiety. However, Ativan is often considered a safer option for COPD patients. One of the main advantages of Ativan is that it's less likely to suppress breathing compared to Librium. This is crucial for individuals with COPD who are already at risk of respiratory complications. Ativan is also shorter acting than Librium, meaning it's cleared from the body more quickly. This shorter duration of action allows for more precise dosing and adjustments based on the patient's response. This can be particularly beneficial in patients with fluctuating respiratory status. While Ativan is generally considered safer than Librium for COPD patients, it's not without risks. All benzodiazepines carry the potential for side effects, including sedation, dizziness, and confusion. Close monitoring remains essential. Section 6. Safe withdrawal management strategies for COPD patients. Managing alcohol withdrawal in COPD patients requires a cautious approach. The goal is to minimize withdrawal symptoms while ensuring respiratory stability. This involves medication and close monitoring. Symptom-triggered dosing is common. It allows precise treatment and minimizes oversedation. Benzodiazepines like Ativan are often used. Close monitoring of vital signs is crucial. Early identification of respiratory distress allows prompt intervention. Managing withdrawal in COPD patients requires a team approach. Open communication and coordination are essential for patient safety.